Hi friends, and welcome to another edition of The Helpful Dad. Today's discussion is about the insulin action profiles for canine diabetes. So if you have a dog with diabetes, please pay attention.
So the first thing we're going to look at is what happens when a meal occurs as far as the blood glucose levels within the body. And what you can see right here is this axis will show you the blood glucose levels as they rise up, and this is the time. And I've drawn here what happens at meal number 1. This process will be repeated depending on how many meals the canine eats. So what you can see right here is when a meal occurs, within that first hour to 2 hours, the blood glucose rises as a result of the food that was taken in. And in a normal canine, the insulin in the body would help to lower that blood glucose, get the glucose, the sugar, into the cells so that the body has energy. Once that process is completed around the meal, then the rest of the time, the normal body's response is to produce background, or what we call basal insulin, throughout the rest of the day. This would be in a normal canine, and the process would then keep the blood sugar at a relatively constant level so that there wouldn't be too high blood sugar or too low of blood sugar. So this would be a normal physiologic response, and it'd be what you're looking for. The next thing we need to do is to look at what insulins are actually available if the canine cannot produce sufficient insulin on their own to control blood sugar, and thus they would have diabetes. So again, what you're looking at here is very similar to the last graph, but now we're looking at the insulin profiles. In other words, how well does the insulin suck up that glucose and help it get into the body? We can see the actual insulin level and the time of day over a 24-hour period. The first line, this black line here, is what we would call a rapid-acting insulin. It gets into the bloodstream very fast, it sucks up the glucose very fast, and brings it down very fast, and it's pretty much in and out of the body. It would be the most physiologic way to control blood glucose quickly around meal times. Second to that is an older insulin called regular insulin, and this acts similar to rapid acting as it is for meal times, but it has more of an extended profile and doesn't quite get in and get out as fast, but is still very good for controlling the meals. Third is a product called NPH, and this is drawn right here for you. As you can see, it's more of an intermediate acting insulin. It doesn't quite act when the meals are occurring, and it doesn't quite last a full 24 hours. It's kind of more of an intermediate. And what you often will see is canines, or even humans for that matter, starting on an NPH twice a day. It's not perfect, but it can be adequate for controlling overall blood sugars when given twice a day for a full 24-hour period. The problem is when you're not matching up the meals with when the insulin is actually peaking, it could be missing the glucose that is in the body for an extended period of time and then sucking it up when the canine or the human is not eating and causing low blood sugar or hypoglycemia, so in other words, swings in blood sugar. The later two options, right here in green, or this flat curve in red, these are your longer action insulins. One is Detamir, or they're called Levemir. The other one is Glargine. You may know this as Lantus insulin. These would be longer acting insulins, and they would be good for controlling the background insulin, but they wouldn't be an appropriate choice for a canine because you would also need something to control the meals as well too. And if you do your research, you'll see that sometimes cats or felines do better with just these longer acting insulins alone, but canines would need some sort of a combination. So let's talk about that. I'm going to show you what I prefer for canines. It's what we actually use on our own Yorkshire Terrier who has diabetes, Sassy. You will meet her throughout the course of this series of videos on diabetes for canines. And this is Novalog 70/30 mix. So what you're getting here is actually a combination of a rapid acting insulin as well as an intermediate acting insulin. And this is why I believe it's appropriate. Again, you're going to see the rise in blood glucose over the time of day. Now, if a human or a canine ate 3 meals per day, you would see, again, 3 spikes in blood glucose, and so therefore you would need ideally 3 shots of a rapid-acting insulin to immediately bring the blood sugar down, as well as some sort of a long-acting insulin to control it. So what the fact is, though, that many canines will only eat twice a day, and the nice thing about this particular insulin, again 70/30, or you may see it as also 75/25, is it gives you a a portion of an intermediate acting as well as a rapid acting. And what you're going to get then, let's say they eat 2 meals a day like our canine eats, you will then be able to control the breakfast meal, get it back down to normal where the intermediate insulin will then take over, and then you'll get again another shot at right after dinner and bring the blood glucose back down and control it during the night. Now, I recommend that when you use an insulin like this, any sort of rapid-acting insulin, you certainly want to guard against hypoglycemia or low blood sugar. So the way we do it is we feed first, test the blood glucose, and then as long as it is not in a hypoglycemic state, we know the glucose is going to be rising because the food has been eaten already, then we give the shot within that first half hour. We have found that to be pretty effective at being able to control the blood glucose and keeping it within a normal range for as long as possible throughout the day. And obviously that is the goal. Can you keep the blood glucose at a normal range for the most part throughout the day? And again, normal, as we've talked about in some of our other videos within this series, is a blood glucose of 70 to 130. If you haven't seen the other videos, be sure to take a look at them. You can get other tips on how to test blood glucose in canines as well as the different monitors. So hopefully this has been helpful for you. Thank you and God bless you. And if you have any questions about canine diabetes, please ask your veterinarian, or you can email us at helpfuldad@gmail.com. Thank you.
So friends, if you like these videos, please share your comments and ratings. And if you have any questions or would like to see something else in the series, please email us at helpfuldad@gmail.com. Have a great day.